Hello guys and welcome back to my channel. So in today's video we are going to talk about shigellosis, paroxysmal ventricular tachycardia, frostbite, food poisoning, bursitis and atrial fibrillation. So a very quick revision of all of these topics. So let me highlight the main key KROK points for these questions for you. So let's start with the shigellosis. So Shigellosis is basically a bacterial infection which is caused by Shigella species. So primary Shigella flexneri, Shigella bondi or Shigella sonni. So it will cause the bowel movement problems. So as I've written here, like in the diarrhea and other GIT problems. So let's see the symptoms. Symptoms will be diarrhea, bloody mucus with the diarrhea, abdominal cramps will be there, or fever will be there. The asthenovegetative syndrome in all the infections we always see. Tenesmus is some good finding for it, like the painful sensations of needing to pass the stool even when the bowel is empty. So nausea, vomiting are associated with it, and falls calling for defecation, rectal split. So let's see some questions. You will understand it or catch it very well. One thing to remember here in the corner, that Shigella is most commonly occurring from the dairy products. However, I'll explain Salmonella in a different video, but remember for now that Shigella is occurring with the dairy products. So let's see the first patient. First patient says about the 6-year-old child having liquid stools and vomiting. And on the second day, the temperature raised and pulse is high, scaphoid abdomen, painful sigmoid colon, defecation 10 times. So when the KROK question highlights the defecation very well, like 10 times, 15 times, like this. So most of the time the infectious agent behind this is shigellosis. What liquid streaks of green stools you can see in Shigella as well as in Salmonella as well. So main thing here to highlight is sigmoid. So I have made it here as well. In all the question you will see sigmoid colon is painful. So let's not keep the Salmonella in this video so that you do not mess up with Salmonella. So only thing to remember right now is shigellosis is having the painful sigmoid colon. Next question also says 10 times a day defecation and sigmoid colon is painful. So mark shigellosis. Next question will also say the dense sigmoid colon is painful, asthenovegetative syndrome, tenesmus you have got here, the cramping pain in the abdomen. If you want, you can pause the video and read the question once again. We have a bit lesser time, we all know that, so I have to be faster with that. So let's go next. Next is paroxysmal ventricular tachycardia. Paroxysmal ventricular tachycardia is a type of abnormal heart rhythm where the ventricles beat very quickly. So it's the problem with the ventricle, and ventriculars will beat rapidly. So it will come suddenly and can last for a shorter period before stopping by its own. So normal BP I have written here, you know about it already. So let's see some case directly. Symptoms will be palpitations, dizziness, chest pain, and remember about the heart rate. So heart rate, I'll make a separate video on atrial fibrillation, flutter, VT and all, how much should be the heart rate in all of them. But just for now, remember 150 to 250 can be the case of PVT. So let's see the case. The case says a 55-year-old man with a history of myocardial infection developed a brief attack of palpitations accompanied by the sensation of lack of air, fear, vertigo. BP is severely low because the ventricles are not contracting. There is no cardiac output with the heart. ECG during the attack shows the extended QRS complex. So this is what we needed in the question. So extended QRS complex. So first of all, QRS complex is what? It's the problem with the ventricles. So extended means what? It's tachycardic, right? So 0.13 is a little bit elevated though. So with the heart rate 160 here, discordant shift in the ST segment and T wave, dissociation of atrial and ventricular rhythm, because atrial are contracting, but however ventricles are not having a real contraction. Ventricles are tachycardic because they are just vibrating or something like that. Disturbance of cardiac rhythm is paroxysmal ventricular tachycardia. So remember the KROK question has been asked, the paroxysmal ventricular tachycardia. Let's go next. So next is frostbite. Frostbite is a cold-related injury that occurs when the skin and underlying tissues freeze due to the exposure of the extremely cold temperature. Most commonly affects the areas like finger, toes, ear, nose, cheek. Most commonly in the KROK questions you will see the finger and toes. What happens is the patient, maybe alcoholic patient, fainted or maybe after getting too much drunk. So in the snowfall he might be kept on lying so for the longer times. So after the longer exposure exposure with this much of temperatures, severe minus or negative temperatures, the symptoms we are going to see in the patient will be cold, numb skin, red, white or bluish discoloration of the skin, hard or waxy skin, blisters or loss of feeling. Maybe the sensation is lost. So let's see the degrees of the frostbite. So I have collected them in one photo itself so that it's easy to remember, or you can take a screenshot of it. However, I'll make it simple in the end of the topic. Let's see the first degree frostbite. First degree frostbite, also known as frost nip. So it's only the outer surface layer is affected when the person is prolongedly as exposed to the negative temperatures or snowfall. So reddening of the skin we can see white or pale skin, or so there is no permanent damage. I wrote it here that there is no permanent damage. So in the first degree, it's like for a little bit time, we all have noticed maybe in the snowfall. So first degree can occur in any time in anyone. So it will be just whitish of the fingers and paleness of the fingers, so there will be no permanent damage. Let's go to the second degrees. In the second degree, what happens is blisters within 24 to 48 hours will appear. So this is the main character of the second degree frostbite, which will involve the epidermis as well as dermis. So third degree frostbite includes the deeper tissues. So they may include they may say like skin is blue or gray or black a bit. In this case we will see in the third degree we will see those blisters we have seen in the second degree are started to bleed now. So this is about third degree, and the patient may be complaining about they are stiff or immobile, because third degree is already severe. So let's go to the fourth degree. So fourth degree was, as you know, that this is the last stage of frostbite. So fourth degree is characterized by necrosis. So let's see some questions. So 10-year-old boy outdoor in the cold weather having moderate pain, tingling in the fingers, tips of the finger of toes are white and their sensitivity were lost. So the affected areas are warming up the fingers and tingling and the pain. So skin color changes into the redness, tingling stopped and slight itching and swelling of the fingers appeared. So there is the question is a bit incorrect, because they however mentioned some blisters in the question, or let's say the tips of the sensitivity loss, sorry. So they mention about the sensitivity loss, which is not the character of first degree, but the answer in the KROK questions is first degree. So and a second patient, let's see, the second patient also complains about the decreased skin sensitivity. So a decreased skin sensitivity and all of these characters are related to the, however, let's see the question. Edematous toes, bluish skin, painful and reduced movement in the joints. So these are the characters of advanced stage, or let's say second degree stages of the frostbite. So but the thing is, in the KROK questions, the only question about the first degree, I have solved a lot of times that whenever you are solving the KROK questions, the question may be incorrect about the frostbite. So remember, for the KROK special treatment, the KROK special diagnosis, so they are asking the question only about the first degree. So let's highlight it again. So in the first question, the patient complains about the tingling or the slight itching and swelling. So it's the first degree. In the second question, the patient complains about the bluish discoloration or a little bit decreased of sensitivity. This is the character of frostbite. Also, the main key point to highlight this thing is that in both of these questions there is no permanent damage of the things. So the problem will be like almost auto resolving. So remember that when there is no permanent damage, remember to mark about the first degree frostbite. So let's go next. Next is food poisoning. Only one question over food poisoning: when you consume a contaminated drink or food, so usually caused by bacteria, virus, some parasites or toxins. Symptoms we can see is bowel movement changes, nausea, vomiting, cramps and fever, weakness and fatigue and headaches. So the first question, only one question over it. So in some factory there was an outbreak of food poisoning with the streptococcal etiology. So the 15 people got sick with that. So what sample should be obtained for the analysis? So vomiting, they are vomiting already, nausea and vomiting we see in the symptoms. So we will take the etiogenic agent, we will take the vomit mass, and we will come to know about the etiogenic agent. So this is it. And the next, bursitis. Bursitis is the inflammation of the bursa. Bursa is a small fluid-filled sac that cushions and reduces friction between the bones, tendons and muscle around joints. So However, even bursa is present in a lot of places. So common sites are shoulder, elbows, hips, knees, ankles, heels. Symptoms which you can see are pain, swelling, stiffness, tenderness. So let's see the case study of it. So a man injured his right elbow with wire. So wire is mentioned in some many more questions. So 3 days later developed edema, hyperemia, reduced range of movements in joint. Why reduced range of movement in joints? Because the bursa got enlarged, so it will cause congestion and the movement of the joint will start to reduce. Intense pain is there, local and general increase of the temperature. That's vegetative syndrome because the inflammation is there. Flu-like symptoms like fever, cough will not be there. So right elbow is enlarged. Elbow is enlarged because the bursa is enlarged. So skin over it is edematous, hyperemia, regional lymph nodes are enlarged, thick and painful palpation, and the right elbow detects sharp pain. Sharp pain whenever you palpate the bursa, so the patient will report a very sharp pain. It is a very painful fluctuation. Diagnosis bursitis. So I hope you understand that. Let's go next, the last thing for today's video. Next is arterial fibrillation. So arterial fibrillation simply means this is the most common type of arrhythmia, abnormal heart rate as we say in our language. So characterized by the abnormal heart rate or irregular heart rate. So it occurs when the arteria experience an electrical impulse which is disorganized. So it will lead to the insufficient contraction of arteria. Like the arterias are not really contracting, they are just vibrating, as in we have noticed in the case of PVT. So symptoms, what we will see palpitations, irregular heartbeat, so shortness of breath, fatigue, weakness, chest discomfort or pain, dizziness or fainting, reduced exercise capacity, lack of P waves. So this is the main key highlight of these symptoms of the arterial fibrillation, that lack of P wave when there are given in the question. So P wave, first of all, remember about P waves, that P wave is the character of arteria. So arterial contraction is suggested in the ECG P waves. So and if so that you don't mark it incorrectly with the arterial flutter. So in the arterial fibrillation, the heart rate will be like 120, 150 or something like that. In the cases of arterial flutter, the heart rate can go up to 230, 250, 260 like that. So you will not mark it wrong anymore. So let's see the case study. The patient is 38-year-old woman, and after physical overexertion suddenly developed palpitation, dyspnea, dull pain in the cardiac area. So for the 10-year registered for the regular checkups for the rheumatism as well as mitral valve disease and non-disturbed blood circulation. Pulse is high, BP is low, heart rate is 120, significant for the arterial fibrillation and not the flutter. So this is the main finding which you will find it in the direct finding in the KROK question. ECG findings are important for you. So small unevenly sized waves in the place of P waves. RR intervals are unequal strength. RR intervals are of unequal strength. We understand that due to bradycardia, unevenly sized waves, P waves in the place of P waves, unevenly sized waves, because the arteries are vibrating, they are not contracting. If a sharp and good contraction will be there, so the P wave will be good, but there is no good and sharp contraction. So this time there will be, as the artery is just vibrating, so there will be some sort of unevenly sized waves over there. So this is it with this video. I hope you enjoyed the video, and if you will watch it again, so you will never forget these pathologies. So this is it. Wait for the next video. Have a nice day.